I wanted to welcome you all to the CTSC's Science Cafe. This month is on rural health. And so those who are not familiar, I just wanted to provide a brief overview of the Clinical and Translational Science Collaborative, or the CTSC. It's a collaborative among Case Western Reserve University and its affiliated partners that include Case Western, Cleveland Clinic, Metro Health, University Hospitals, the VA, Northeast Ohio Health System, Northeast Ohio Medical University, and the University of Toledo. So the CTSC aspires to be a catalyst for high-quality clinical and translational science and transformative research to positively impact the health of those in Northern Ohio and beyond. So this is being accomplished through 5 key areas and initiatives that are shown here: resources and services, workforce development, community engagement, health informatics, and clinical and translational funding opportunities. If you're interested in learning more, please visit the CTSC website, and there'll be more resources and QR codes at the end of this session. So today I'd like to welcome Dr. Fredrick Schumacher for a discussion about his work related to rural health. So Dr. Schumacher is an associate professor in the Department of Population and Quantitative Health Sciences at Case Western Reserve University School of Medicine. He also is a co-leader for the Population and Cancer Prevention program at the Case Comprehensive Cancer Center. His work focuses on deciphering the inherited genetic architecture of complex traits, assessing the shared genetic etiology of complex phenotypes to elucidate the underlying biology, and determining the clinical impact of inherited variation. And with that, I will turn it over to Dr. Schumacher.
Thank you very much for the introduction. Hopefully everyone can see that first slide. Good. So first, thanks for joining. I know everyone's end of summer and taking a 12 to 1, from your lunch hour or just a midday break. Hopefully this is going to be an informative discussion. And I kind of stress the word discussion just to show, I've got a couple breaks here where people can unmute themselves and interject any kind of thoughts and opinions. Because, I am a trained statistical geneticist, and as Mackenzie, described in a complex way, but it's really simple, is like, I'm a gene finder. We like to try to understand what genes are causing a trait of interest, particularly for me is cancer. So how I ended in rural health in some ways is probably a little bit not obvious, but I'm not an expert in this. I've just been developing some skills. And so one, I want to hopefully kind of show you that, like, if you're not feeling comfortable maybe trying to start your own study or thinking about doing research in rural health environments, if someone like from a statistical genetics background can do it, then it's pretty much possible for anyone to do it. And then 2, just to provide you some information on a current project we have going on there and some of the ways that we got there, might, prove some experience, some things that might be helpful for you and your own kind of research and your own work. So because I'm not an expert in this, I had to rely on heavily on a number of people. So I'm just kind of acknowledging them first in the beginning. I noticed a few people that are actually listed here are on the call. So, this is the team that kind of really motivated this project, made us really think about how we could introduce ourselves into the community. The first part is this, because it's a funded group, the Healthy Futures Research Team. I've worked with our community engagement team in the Cancer Center led by Erica Trappel. Also worked with some people who have clinical expertise, such as Maeve McCurdo and Maura McCall, and then working with Daniel Tish from the Public Health Program and a number of others. This includes people within the East Palestine and surrounding communities that we've worked with. It also extends beyond that and also includes people from the marketing and communications, because one of the things that we saw was really getting the word out about our program or our study in rural areas was really important, and working with the communications team at Case to make sure that the message was on point and that it was targeted toward certain groups in the area was really helpful. And then also with Darcy Friedman and some others who organized a separate research consortium that included people from Case as well as from Ohio State Extension, such as Haley Schumacher, also from the University of Pitt with James Fabziak, and then a community partner, Wes Vins, who is at the Columbiana health department. We'll talk about that a little bit later. So one question I just want to ask people and how I guess what their impression is what is rural health? What is rural health to you, I guess? Any thoughts? You can unmute yourself in between bites.
To me, rural health is the availability of health care for people living in areas that are rural and very unlike Cleveland with our wealth of healthcare opportunities.
Great, thank you. Yeah, so not being close to an academic health center, right? And I think, and we'll get into this a little bit more. Anything else from some others? I mean, it's kind of exactly what Deb said, is the health of people living in rural areas that may not have some of the access available. And, you know, and access can also be lack of access can be in urban areas too for different reasons. So I think a lot of things, what I begin to see is a lot of the same obstacles translated across urban and rural areas. It was just maybe different solutions had to be kind of thought about to address those obstacles. But a lot of them are still somewhat similar. And one of the first things is how do you define rural? Does anybody have any ways that they would define it?
Farmland. Population density.
Great. Yep. Farmland, population density. Anything else?
Just drive 10 miles south of Cleveland.
10 miles south of Cleveland. Yeah. So I think what you're seeing is there's a lot of definitions of rural. And this becomes important for a number of reasons. One, like when you're applying, and we'll talk a little bit about some funding opportunities, how you can be funded, you might have to meet a specific definition of rural. And there's certain offices within the US government that define this. So even if we think 10 miles south of Cleveland or 10 miles east of Cleveland is rural, that doesn't always fit the definition for some of the funding agencies. If you ask my kids, this is the way they're going to judge rural, right? Is anything in the red box that if I got one bar or less on their cell phones, they're kind of figuring that they're in a rural, even though there are spots in Cleveland where you can hit dead zones and other things that also show that. But it depends on how we want to define this. You know, I think some of congressionally, there's a number of ways to define rural, and that's usually on when you're trying to target specific constituents, right? Sometimes they relate it more to farmland and how much areas of acreage that's devoted to the production of farming versus non. But then that can still not include things like national or state forests. That might be also non-commercial as well. So congressional can have a little bit different definitions. For researchers, we like to kind of bin things, right? So we think of things as being either metro or non-metro. And then how we define that is a lot of the times has been relying on these two bottom options. The US Bureau of Census, they have more of a statistical definition that was mentioned, you know, about thinking about population density and also relationship to metro areas for employment. And then the US Offices of Management and Budget has their own definition where they kind of put together similar to the population density, but not necessarily density as more of a clear cut point. So this is pretty wordy, but you can see here, this is from the US Office of Management and Budget. This is the way they define metro counties versus non-metro. So they like to bin it, and then you can see the color on the United States here from each specific county. And one of the things that they really define a metro county as being is the density or the number of people who live in the area. So they really just say if it's 50,000 or more people, we're going to consider you a metro county automatically. Also, you could be a metro county if the majority or a quarter of your workforce commutes to that county to work. So you can think of Cuyahoga County, you know, being 10 miles south of like Stark County or Ashtabula or Geauga. Those individuals commuting into Cuyahoga County would give even if Cleveland was below that population, would allow it to become a metro area. There's also the reverse commuting pattern where people might be moving out toward a factory that's kind of been recently built. You think about the South, where a lot of the automotive plants have been recently relocating. Those are causing this reverse kind of metro area. And then you have the non-metro that can be divided into two different ways, being non-core or just like micro, where it's kind of like a budding micro metro area. And this is really how the U.S. offices or OMB defines it. When you look at this compared to the census, so the OMB is on the left-hand side, the map of the U.S. counties from the U.S. Census Bureau is on the right-hand side. You can see a lot of it overlaps pretty well. So the Census Bureau likes to define large blotches of metro areas, or what they call urban, and that's the blue dots there. And then the metro counties being more of the gray here, similar to the other side. And then the orange really reflecting the non-metro. And then again, with the OMB office, you have that non-metro counties being divided in two different sectors. And if we look a little bit closer just at Ohio, you can see that Cuyahoga County, Cleveland is the blue dot over here on, whoops. Cleveland's up here on the lake, and you can see going down to Akron and even down into Canton, and all those counties that those are bordering or are also considered metro. And then you have a little bit more of the non-metro counties, the orange over here with like Holmes County, Tuscarawas County, and then over here, this one that I'm circling is Columbiana County, which is where our project is with East Palestine. And you can see it kind of lies right in the middle between several different metropolitan areas, including Cleveland and Pittsburgh. Just north of it would be Youngstown, and then a little bit further west would be like the Columbus area. And even within these counties, though, I think you can, because we're taking a large geographic area and defining it as either metro or non-metro, can be a little bit deceiving. So, for example, I grew up over here in just across the border from Toledo, Ohio, in Michigan. And even though this county is considered a metro county, partially because it's between Detroit and Toledo, and also has some affiliations with Ann Arbor, I would probably say that if you lived up here and toward this north west corner, it was much more rural. So even though my county was considered metro, we would probably really I would consider myself where I grew up was more non-metro. Probably about 60 to 75% of the people in my township was involved in agriculture. So it was very much related to farming, and we definitely didn't have a high density of people. So these definitions can vary somewhat. And the point of this is that a lot of times when you're then looking for funding opportunities, there are certain restrictions put on by these different offices. So they might have certain funding opportunities where they base it on what some people might have heard of as a rural urban county catchment criteria, which is a RUC score, or there's also one from the U.S. Census Bureau called a RUCA score. And for the most part, if you look at how they overlap compared to all counties or all people within the U.S. population, so this was from 2020, where we had about 313 million people, 13 million people. You can see that the majority of them would be captured within urban areas. 9% would be both classified as rural, and then just some discordance. So it's always going to have to be clear on how you're kind of actually defining that. And that's a little bit more of some of the technical thinking of what is rural, right? And yeah, any questions?
The Browns still have 3 years left on the current stadium before they can. So once again, they're bluffing, I think. They're bluffing. They still got 3 whole years.
If they want to secure its spot?
Because they want to try and pressure the mayor into giving them more subsidies to pay for the stadium, and it's just like, and then once again with inflation, it's probably so what?
Thanks. Sorry. Good conversations going on. Different presentation, but maybe that can be at the end when we discuss it. So just curious, that's a little bit of some definitions of rural. What are some ways people might define health disparities? Or what do you think is a health disparities in urban versus or metro versus rural health? For example, I would say, there's definitely some cancer differences, not all cancers, But there's definitely some cancers that have a higher incidence within rural areas versus non-rural. Anybody else thinking of other diseases or other things?
Frederick, this is Joan Toman from CSU. I was thinking of injury. There might be different type of injuries in the rural areas as opposed to an urban area.
Yep, that's a great one. Unintentional injuries or accidents.
Yes,
Yep.
sir.
Anyone else? Anything else?
In the chat, someone
So-
said lower screening occurrences and then also chemical exposure differences, such as pesticides. And then another person said chronic diseases like asthma and diabetes. And then someone just said malaria.
Yeah, no, those are all great examples. Thinking of the environmental exposures, like I said, where I grew up, a lot of it was farming. I can remember in the spring when, you would have a certain chemical smell or taste would actually happen because people would be prepping to prepare their fields. And the wind blows, it's not isolated to one area. Definitely all of those are under this. If you look at any kind of particular health disparities across rural areas, it's going to include almost anything that we, depending where they are. So some of the screening issues, there's definitely been some some counties that have much lower screening for cancer, and they see much more aggressive disease at diagnosis than you would for typically in other urban areas. Unintentional injuries such as like opioids, some of the motor vehicle deaths definitely have differences and disparities. There's also people who have multiple health conditions. And so this is becoming more and more apparent as people are living a little bit longer. They're being screened and diagnosed. And what does that actually mean for the management of care, which can get complex? And if you're in a rural environment, it's not easy to make a weekly or a monthly doctor's appointment for multiple different conditions. So how you actually have access to that healthcare and be able to manage that is definitely something that's being considered. So these are just some potential reasons for some of these health disparities, and I think a lot of them have already been mentioned. The environmental hazards is definitely something that we'll talk a little bit about later on. Transportation options can be somewhat concerning, but even within a agricultural area, food deserts are and I know that's not a common term anymore, but just having lack of access to high quality foods is definitely a concern. You also have a lot of migration populations coming through some of these agricultural rural areas, which can then, have higher rates of poverty, also less health insurance coverage if they're not particularly, fit criteria for that access. And then there's the lifestyle risk factors. So we've looked at a number of risk factors within, like, say, Ashtabula counties and some of our cancer catchment area. And we've seen that like smoking and alcohol consumption is much higher compared to some of the suburban areas. And then when you look at more urban, you also see that rise again. So this is, again, one of those obstacles that is common to both urban and rural, but might have different reasons of why people have, initiate it and have difficulty with cessation. So this all comes into then possible funding opportunities. And I wanted to make sure that people, if you're interested in rural health, there's a number of RFAs that become available through either the National Institutes of Health, which is one mechanism I'll talk a little about later on here. But it's not always easy to find other ones by different type of sponsors. There's a number of offices within the US government that has these funding opportunities. This is a really nice search crawler that you can use to look for things that are focused more around rural health. And some of these definitions change a little bit depending on the topic and then what state you're looking at. So whether you're using a RUC score or a RUCA score or some other type, this is a good way to get exposure to some potential grants opportunities here within rural health. There's also ones that look at more at clinical access. So more of how can healthcare be delivered. So HRSA has a number of opportunities here. So this is a little bit more specific for rural health. The Federal Office for Rural Health Policy really focuses on some of these main areas down here on how you can strengthen the health networks and thinking about how you can get delivery there, and maybe even working with some of these rural hospitals. And at least in Ohio, I think some of these rural hospitals are becoming more and more rare as they're being, put into under footprints of larger partners. And so sometimes working with those is going to be a little bit difficult in some areas. And then the last one is if you're thinking of more of like, and this is something that we're starting to begin to think about, is, some of the infrastructure available within some of these areas isn't as readily available. So there's some opportunities here for specific areas of rural communities, particularly Appalachia. And if you didn't realize, Appalachia runs from obviously the deep south in the Mississippi, but then all the way up to the Finger Lakes region. It actually borders right along western New York, is considered part of the Appalachian map. And if you go to this website, you'll kind of see how it goes up the Ohio-Pennsylvania border and extends into New York. So some of the areas that we're looking at are actually considered under Appalachia, which then gives you a little bit different, some potential funding opportunities or mechanisms that may not be available for, communities out west or other areas. Anybody have any other funding strategies that they would consider that might be outside of the scope of what I just kind of listed? There are opportunities sometimes for more private funding, foundations and others, but those are a little bit usually more topic oriented. If you think about it from like, breast cancer awareness or thinking about Parkinson's or neurological diseases, sometimes that can be a little bit hard in rural areas just because the density and the numbers that you're going to be, the impact is going to be a little bit different than if you're more in an urban area. Crowdfunding, that's a great one. So I'm just starting to catch on to look at the chat here. Crowdfunding is definitely a good one to think about. Again, it's also something, rural residents are definitely very interested in understanding the health disparities that exist in their communities. But some of it is, there's not a lot of sometimes access funding available or money available for them to contribute, but that's definitely one to consider. So one that we considered was more related to an environmental exposure, and we're going to talk a little bit about this. But this was just to let people know of this mechanism and this is through the National Institutes of Environmental Health, and they have a rapid response mechanism, and you'll kind of see why it fits under this. It's more designed that like a typical NIH grant, when you submit something, it's probably 9 to 12 months at maximum that you can until you would have it funded. This one is supposed to be a little bit faster. So the idea is that they can receive these grants and turn them around within about 7 months from submission. And this is going under the full review panel as well as the scientific review and so forth. It was something that we applied to in April of 2023 for this mechanism, and it went through. We didn't get funded until February of 2024. So it was a little bit longer delay than anticipated, but it was faster than probably the typical grant mechanism. And this brings me then to like what we got funded. So we submitted this R21 rapid response, and the idea was to look at the train derailment that happened on February 3rd of 2023. And we've named this study the Healthy Futures Research Study. This was really based primarily within East Palestine, which I'm sure a number of people saw in the news, but then also thinking about the surrounding communities, knowing that some of the environmental exposures isn't going to necessarily stop at borders. It's going to be something that can move through the water, through the air, or through the soil. And so if you're not familiar, East Palestine, Ohio was that one county that I pointed out that fell into one of those non-metro designations by the Office of Management and Budget. And it's over here in borders Pennsylvania. Right above it is Mahoning County, which is then primarily Youngstown, and then Cleveland over here, and then Pittsburgh was further away. So it kind of falls into this area that has a little bit less access to an academic healthcare center, where, if you think about probably people who are in Lake or Geauga County, you're going to have direct access pretty closely to the Cleveland footprint. But here there is a little bit more fragmented healthcare. And so that has made some difficulties and some things that were challenges that we're still trying to address. But things to kind of think about here. But a very nice town, very quaint area. Reminds me of, like, some of my relatives grew up in Tuscarawas, or were from Tuscarawas, Ohio, and has a little bit of familiar footprint as that. If you look at the people within the areas, and I'm focusing on 4 counties here, primarily because this was part of our grant application, but you can see the population for the 2 Ohio counties as well as the 2 Pennsylvania counties, ranging from like 100,000, or slightly less than 100,000 to over 230,000, which is primarily Mahoney County. Looking at some of the demographics there, and most of the people, about 40% were people who were more in the midlife. And a young number of people, about 20% were younger, and then about 20% being a little bit older. Primarily population of white ancestry, or European. And then you can also see like the percentages of high school graduates versus the income status, to give you a sense of just what is the community that you're going to be working with in this area. Just beginning to know our study. And so what we did, we've been looking at this as part of my role in cancer, is we've looked at number of cancer statistics across primarily Ohio, but a little bit also in Pennsylvania. And if you look at the trends at the top for both states over the last decade, the mortality rates have trended to become a little bit lower. And if you look a little bit more into each of the counties, you can also see that there's some differences, though. So just south of Columbiana County, there's a little bit higher rates of incidences. And then up along this Appalachian border here, you can see, including Ashtabula, there's a little bit higher of instances. And then when you look in Pennsylvania, you see somewhat of a similarity there. But when you look a little bit closer at each of those, you can see that for some cancers like breast and lung and prostate, they're very similar to the Ohio average for both incidence and mortality. For breast cancer, it's actually lower incidence in Columbiana compared to Ohio, and for both incidence and mortality. Similar, that's something that you see for lung and prostate. But you also see some cancers that actually have higher rates, particularly within bladder cancer. For Columbiana is slightly higher for both mortality and incidence, as well as colorectal cancer and cervical cancer. And this can give you a little bit more indication of what are those preventions that we could introduce, from bladder cancer. We know that smoking and some chemical exposures are some of the major risk factors. We also know for colorectal cancer and cervical cancer, we can do a little bit better either with screening. And if you've been seeing some of the recent changes in healthcare, I think the FDA just approved in May of 2024, self-screening for cervical. So you can actually pick up you can self-sample and send that into a company, and you can have it tested for the presence of HPV, which is then a good indicator for your risk for cervical cancer. And then also, if you haven't seen any of these commercials, I'm pretty sure most people have, is Cologuard is now available for colorectal cancer. There's definitely some concerns and arguments about whether we should be using these type of mechanisms, given that they're not as sensitive for pickup as something like colonoscopy. But if you're in a rural area and it's not easy to have access to that colonoscopy, where you have to, you need to go into a medical center, it is an alternative that's kind of seeming to pick up more momentum. And then just lastly, looking at some other statistics within Columbiana County versus Ohio to have a better understanding of what we're working with, is just on screening. And you can see, for the most part, the on the left-hand side is looking at different cancers and whether you're picking it up at early stages versus late stages, and comparing that from Columbiana to state of Ohio. Columbiana isn't lagging anywhere much differently than the overall state of Ohio when you're looking at both looking at lung or colorectal and even cervical, and then looking at some of the screening mechanisms for each of those. And what we found when we went down to this area, because I think there's some assumptions sometimes that maybe people aren't screening as well, they're not as informed about what those recommendations are. The Columbiana Health Department has had a screening program since the mid-1970s that's been very active. And so they have definitely had educational campaigns. They've had the different health fairs that were set up. And this has really created a community that is pretty aware of what some of those screening recommendations are. So something like cancer, it hasn't been as apparent that there's like a dearth in certain screening, even though this is a pretty rural area. And that really has come through the efforts done by a number of people within that health department. And then obviously, what really kind of, besides just what really got our attention was when the train derailment of February 23rd happened. And so, not to dwell on these pictures, but it definitely created this environmental hazard, both in the local community of East Palestine, but then with the plume being what it was, it's definitely has had impact across the region. There was just a recent study that was published out of Wisconsin that had found that I think there were 16 states that had picked up contamination from that plume. So it's not a geographic thing that was only within those counties. It crosses state borders as well. So this led us to put together one of these R21 applications. And some of the main things we wanted to do was figure out what is the community engagement. Work with the community, some community residents, find some partners that were in the area to understand what was some of their current prevalence of health concerns, and then how was that being changed after this derailment. And this was really then to have this engagement with the community members to collect the baseline information, and then also just begin to start a healthy Healthy Futures cohort study for the future. And this was really going to involve getting baseline questionnaires as well as baseline biospecimens. And this is ranging from DNA to plasma and serum. And really, this is then where I kind of came into my expertise, was thinking about understanding what is the impact of an environmental exposure on the intermediates or the developed trajectory of health. And so one of the strategies we've been thinking about in my lab is genomic aging. So you think of chronological aging is pretty straightforward. It's just, the number of times you've went around the sun. But something like genomic aging has become a little bit more interesting. This is thinking about how does your lifestyle or your exposures affect your genomic integrity, and whether that then contributes to what you think is the aging process that then allows more mutations to occur and then leading to disease susceptibility. If anyone's interested in aging, there's a paper that's from Cell in 2023 that breaks it down into these 12 major categories. Some people have probably heard familiar with telomere attrition. So as you age, your telomeres get shorter, which then may lead you to higher risk of disease. Epigenetic aging has been a major research area of lately. This is partly because technology allows us to measure this at a pretty good cost. But there's also interactions with dysbiosis or the microbiome, as well as thinking of like chronic inflammation, mitochondrial changes, and others. The ones that we were looking at was more genomic stability. And this is an idea that, we know certain exposures, particularly at high levels like ionizing radiation or UV, can damage parts of the DNA that may not be completely repairable, or maybe something that is subjected to prolong itself and lead to a disease. And part of the work that this was based on was some research that I was interested in and looking at was when a study that came out in PNAS in 2022, where they looked at pediatric patients who were undergoing chemotherapy for cancer, for leukemia and other bloodborne cancers. And they took a pre and a post measurement on their somatic mutation change. And one of the things that they noticed was, obviously there was this high dose of chemotherapy that obviously needed for their treatment, but it also increased their mutational load. So their mutational burden increased from the previous to the prior. And one of the things that they also noticed was that eventually that would come back down to baseline or close to baseline. But the difference between the baseline of how close you got was based on your age. So even within a slight age change from going from 5 years old to 12 years old, the patient that was older was much further away from ever getting back to their baseline after about 18 months after the initial chemotherapy. So this really kind of demonstrated that as you age chronologically, there's an accumulation of effect that's causing the DNA repair system to not be as effective as it normally would. And this is something that we thought that then thinking about chemical exposures, if you get a high dose of a chemical exposure from something like a train derailment or other things, that kind of increased exposure could allow us to begin to think about where you're along the trajectory for disease status. And so this is where we basically came to think about this genotoxicity. And so this was the first concept that we were looking at within the East Palestine area. So this is where we began to collect some baseline specimens and then being able to put that together into a long-term cohort that we could follow up and look at the increased risk for disease that may or may not occur. So I will apologize that one of the lessons I learned is, we wanted to put a limit of what residents would be involved, partly for just, this is a small grant. We couldn't cover the whole area, so we limited it to 4 counties. I then used a bullseye to kind of target how that was going to look, and then then people had commented that doesn't always look so as friendly when you think about that like if you're in the red versus the orange and the yellow. So we kind of stopped using the bullseye, but this was just still part of the grant. So the concept being, though, and this is where really the point of showing this is that the somatic mutation rate would maybe, because we didn't have a before sample. So like the chemotherapy study, they had a pre and a post. We didn't have the pre, we were only getting post. But one of the things that we were thinking about was how does that relate to the geospatial relativity to where the event occurred? So the closer you live to the bullseye, the more likely that you would have higher somatic mutation burden versus if you lived more to the outside of that. And that was kind of what this was supposed to reflect. But we've kind of transitioned to that just to think about it as just the overall geospatial distance within these 4 counties. So that was the study we wanted to put together. We were trying to figure out, okay, on paper, the science seemed pretty straightforward, seemed interesting. This is what I get excited about, is that genetics part. But how do you get people to participate? So how would people in their own studies, they currently, maybe if it's even urban, how do you recruit participants?
I think you have to go out and engage the community, right?
Always probably helps a little bit, right? Just yeah. They're not just going to donate samples to you. Someone mentioned community outreach. And yes, I see a hand up.
That's me. Thank you. Joan Tolman again. I get a champion out there, a champion who is known and a trusted member in the community, and preferably somebody who has some knowledge of the research space and can kind of speak to that. And we're actually working on that in a separate section of our CTSC. So I'm trying to make that happen. We're doing that with community health workers. So that a trusted member of the community can be very helpful in the recruitment process.
Thank you, Jen. Yeah, I'd love to hear more about your stuff if you want to reach out, because we finding champions isn't always easy too. So training people up is one thing that we've been considering, but then how do you fund that training within community members isn't always easy as part of NIH budgets, right? Yep. It's not, it's hard to justify that and to be able to do it. They're very interested in us collecting the biospecimens and running these genetic assays, and that's easy. But the hard part is getting the actual people to participate. And, like that was mentioned, the community outreach is one of the big things. And then Tim had put something into the chat box about county fairs. And I'm going to talk about that in a few seconds. But everything you said is some of the things that we did. So we wanted to find community partners, right? Champions in some ways. How you do that isn't always easy. Especially because we didn't have somebody directly in East Palestine. We did have somebody on our research team, Maura McCall, who was from East Liverpool, Ohio, which was just north of the area. That helped us kind of begin to understand some of the area and when certain meetings were taking place. So one of the things that we did was, we attended several different of the EPA weekly updates that were given to the community members, not to recruit, but just to kind of go down and listen, right? Listen to the concerns of some of the people that were experiencing this. We didn't want to kind of come in and say, here's what your concern should be, is this whole genetic mutation rate, and then scare them and show them a bullseye and all that. It was more to think of like, what are your concerns that you are talking about? And what are the things that we can think about how our research might get intertwined into that? Also looking at, talking to some of the health departments. I think if people don't realize, each Ohio county has a health department that is mandated to look at their overall profile of their county and their residents every 5 years. And that gives you a really good insight into what some of their priorities are and who to work with, because a lot of the people that served on those committees that designed those and developed those reports are people that are embedded in the community and know those. Other ones are definitely, religious groups. They seem to, have a community center around those. We know that through some of the urban areas. Also some of the public services, such as fire departments and others. And then, healthcare partners is one I put a question mark in, but it's one that would make sense. But if you're dealing with a fragmented area, it's not as easy to do that. But one of the biggest things that we saw was just kind of building trust, regardless of who we were working with, but by showing up and showing that we weren't just there to do our research, grab biospecimens and go back to our towers and publish and not talk to the community members about what was happening. So really to build up some of that trust there. And we did this, one of the first things we did was we wanted to make sure we could develop accurate information, right? Because during any kind of disaster, I think we saw this, it's COVID and anything, right? There's just inaccuracies of what's being reported and what people are trying to do. So we wanted to make sure at least our brand was put together within a easy, explainable pamphlet or flyer, and to make sure that was disseminated among the community members to know what we were at least involved with and how to contact us if they had any questions, concerns. And this kind of came back to that marketing team that we worked with from CASE in the beginning, was very helpful because they made sure that our message was getting out there to some of the more, I don't want to say legitimate, but just more of the trusted news agencies or news venues versus like something that you might just see online. But of course, online is going to be one area to do it, right? And so we did create a Facebook page for Healthy Futures Research Study that allowed us to engage with other activist group that were happening and then link to their members and their contacts. Rural or not rural, however old you are, I'm not a social media fan, but this is definitely a way to communicate and get your message across. It's one of the things that we had to, monitor, and we still monitor that, but also, it's a good way to meet people, to get a sense of where they are, some of the concerns they're having. The other thing that we had thought about, as Tim pointed to, was this. By the time this was funded and where we were moving forward, it was happening to be in the middle of summer. And if you're not familiar, every county typically has a county fair. And this is a great place where a number of the agricultural groups come together within any county. And so we attended these. So we actually set up a booth inside the barn for the vendors. We weren't selling anything. We did have some paraphernalia from CASE that we gave that was free, mostly for the kids. And I would say a bowl of lollipops are always great, or suckers, because it distracts the kids enough that then you have 5 minutes to talk to the parents to just let them know of what you're doing. And then that was something that passed along that information. And so, we had the QR code, we had things available, handouts that the adults could take home and then do online to get an assessment or to fill out the questionnaire. And then we also gave compensation, right? So that's always helpful too. If someone's going to spend time filling out a survey or giving a biospecimen, we compensated them, between $25 to like $40 for, depending on what they were actually submitting. The other thing is to work with other researchers. So we've definitely worked and collaborated with. There's ends up being 6 grants that are funded by NIHS that are looking and doing work within the East Palestine area, ranging from human health to environment. Darcy Friedman and some others put together a OHPA consortium. They had a number of informative events or state of the sciences that they went down to East Palestine and had presented what was currently available. What we did for this one just recently in July is we were able with the CTSC to get the UH Mobile Research Unit to come down. And they parked right outside the high school into a parking lot. This is I don't know the exact size, and Mackenzie can correct me, like a 40-foot Winnebago that has the UH branding on the side. We didn't do a very good job of getting all the best pictures, but we had this parked there. And we had a number of people who attended the consortium event who then came over and heard about the studies that were going on from these NIHS R21s. And we also had the opportunity to do a blood draw if they're interested on the spot to participate in the study. And we had about 40 participants who came and joined the studies, donated a blood sample.
So I just wanted to share this, and then I will also put the links in the chat. So if you look here, the leftmost QR code is to register for the next Science Cafe on September 12th, where the session will be on enhancing the impact of clinical trials. The middle QR code is to provide any feedback about today's session and also to suggest any future topics for sessions that you have. If you want to recommend just a topic or someone to facilitate a session, there's a space to do so. And then the third QR code is to become a member of the CTSC and to stay up to date with all of the events that are going on.
So Mackenzie, let me comment on something. So hi everyone. This is Grace Mackenzie, the CTSC PI. I'm off today, but I wanted to listen to what Fred had to say. I just want to encourage all of you who do research in rural settings to reach out to the CTSC like Fred did, because we could provide support like we did with him for him. He did get a pilot from CTSC as well as all the cost of the mobile unit, and what he talked about the UH mobile unit going there. So please reach out to us. We are very keen on improving rural health and rural research. It's very hard actually to find researchers who are successful in doing research in rural communities. So please reach out to us. We are very, very interested in supporting such projects. Thank you, Mackenzie. That's it.
And I'm sorry, this is Fred.
Oh,
I
I
see.
see.
Sorry. Thank you, Grace.
No problem.
Can you hear me?
Yes.
Sorry, I apologize. My Zoom crashed, but I joined on my phone. So yes, I guess to do what I caught of Grace is saying, it was I think slide 45. I had the funding, but really it took several partners, including the CTSC and Case Comprehensive Center and a few others, to get this started. A year plus for the NIH to fund anything, and when you're dealing with an environmental exposure, there's just short time. So thank you to that, and the mobile unit is incredible when it comes to phlebotomy draws, because this is a fragmented area with healthcare, and to get a phlebotomist to come over is almost restrictive on the cost, because we'd have to bring some private companies down from either Erie or from Youngstown. So the mobile unit was really helpful, and some things that we've been thinking about is even extending beyond phlebotomy and doing like some pulmonary challenges to understand like some of the lung effects, because of I didn't get to go through all the slides, but some of the concerns and some of the symptomology we've been seeing is some more long-term lung diseases that is persistent. So this has been very helpful. So, and then also just last thing I'd just say is if anyone's interested in collaborating beyond, this isn't just a cancer study. We just got a supplement funded through Lynn Singer, where we're expanding this recruitment age and eligibility from currently the study was just adults 18 and older, but we're now going from 5 to 18-year-olds. So we're going to include children also to understand some of their mental health and some of their distress.
There actually was a question in the chat. I can read that for you. So it says, what do you do when these large options, such as the county fairs, are a while away? Do you think that engagement would not have been that high had the timing of the county fair not lined up?
Yeah, it's a great question. I think we did get very lucky with that. The county fair is running. But there's been some other, engagements we've had too, with working with some of the pastors down in the area, and some of the churches. We've also talked with other groups working with the Columbia Department of Health, and also the Ohio Extension. So I don't think it was the only thing, but it was definitely one thing that, it allowed us to get our word out. The only thing I wish we would have done is with these QR codes is to understand where they were coming from a little bit better, whether it was something shared from someone or, if we could have did a specific one for the fair to know how many came through that. I think that would have been a nice way to understand the engagement potential down there.
And then there is a comment in the chat as well. And it says, great synergy in the van is quite a resource. If possible, this van might be leveraged for biomarker collection post-environmental disasters if standing plans and funding are in place. These are some of the most important missing samples per our university consortium discussions.
Yeah, I wrote that. I think Fred knows that I've said that before, but it's quite an amazing resource. And if it could get down there in the near term after a disaster, those are the samples we really miss and wish we had.
Yeah, I agree completely with that. And that's something that, maybe we can talk to the CTSC and Brace to see how that could be possible. Because it is, any of these natural disasters, one of the, obviously the first thing is everyone's safety and putting out any major concerns. But then the next step is thinking about, what is the long term, be able to collect samples and having that for that study. So.
There's another question. Will you be at the Canfield Fair this Labor Day?
We're trying to. Canfield's been a more of an obstacle. They're I think the largest fair in Ohio, so they're just not as easy to get access to compared to some of the more the smaller county fairs who are happy to have people coming. But we are working on that.
I do see there's another comment that says most small communities will have common popular areas where most of the town goes, such as small coffee shops, pizza restaurants, etc. A great place for you to meet both key people and leave education materials.
Yeah, we've also realized too with the mobile unit, one of the things is, and this is still anecdotal in some ways, but several people just happened to be driving by, was like, why is there a giant mobile Winnebago in the parking lot? And they just stopped and they had no idea of what the event was. So we've even thought, like, what if we just did show up on a Saturday at a grocery store? Like, would you get kind of a similar response? So yeah, it's a great idea of just getting your name out there and sometimes, doing that.
And then someone just put, don't forget about rural pharmacies and places of worship.
Yes. Yeah, a lot of our partners in the NIH group have worked with some of the churches, and we've been starting to. So one of the people that we're trying to have part of our community board is one of the local pastors. Great suggestion.
Great. I don't see anything else in the chat. If anyone has any questions or comments, they can unmute in the last 2 minutes.
Well, and just, for Mackenzie for sending this up, and thanks for, even though we sent you the slides early, it almost worked without problems, but I think overall this is really helpful.
Great. Well, thank you so much. And thank you to everyone who attended. I will send a follow-up email with information about future sessions. Perfect. Well, thank you, everyone.